So what happened to get us into this situation?
There's a lot of steps in there, but if you go back in time, when various insurances first came about, including Medicare and including commercial insurance through your employer, primary care was not included. You paid for that yourself, and that was just an expectation. And then over time, I don't want to make it sound like I'm blaming the unions, but anyway, unions pressured for adding that in, and so it was, but of course for everybody. And Medicare was pressured pretty heavily, so they added it in. So then then the insurance is paying for it. But insurers don't want to pay too much. They're in their own problems. They're trying to reduce costs. And so to them, how do you reduce costs? Well, one of the best ways to do it is to just say, I'm going to pay less. And so primary care gets the short end of the stick. The insurance system is weighted toward folks who do a procedure, whether that's surgery or cardiology or gastroenterology or whatever. And it's weighted against the physician who spends a lot of time with the patient, developing a very detailed history, understanding nuances and so on. So what's happened then is that the physician has to see more and more patients in order to make things work out. I guess I should back up for a second. How to say this fairly simply. So if you're earning less money from the insurer, but your costs have gone up. So why have costs gone up? Well, the costs have gone up because you need to hire people to do the billing and coding. It's just not simple anymore. And every insurer has a different billing system. You have to have people who know each of the different insurers, what they need, what they want, so it doesn't just keep bouncing back and forth. So that's one issue. It costs a lot more money now because of the billing process. Second thing is the insurers, including Medicare, especially Medicare, put out all sorts of regulations and requirements that you have to follow. And this is another time sink. So there's two ways they're taking time away and adding costs, while at the same time trying to hold down the revenue stream. So what's the doctor going to do? Well, it's the old line of make it up with volume. You make it up with volume by seeing more patients per day. And how do you see more patients per day? Well, you can stop seeing your patient in the hospital, as has been the tradition for, hundreds of years. You can stop going to the ER when your patient's in the ER. You don't have time for that anymore. So now you just save some time. It used to be the doc would go to the hospital, early in the morning and see patients and then get back and start office hours. Well, now, if you don't go to the hospital, you can start office hours a little earlier and you can get in a few more patients. But then the big thing is to reduce the time per patient. And if the doc's seeing, like, say, 24 patients a day, and let's assume an 8-hour day, that's 3 patients an hour, 20 minutes apiece. But there's other things the doc has to do. He has to answer the phone, has to look at reports and so on. And so you're really getting 15 minutes. But it's not all with you. You're probably getting 8 to 10 to maybe 12 minutes of what I'll call face time with the doc. And that's a pretty short time. Certainly too short for comprehensive quality care when the patient has something more than, let's just call it, a simple issue.
You just said something
probably a longer answer than you wanted.
No, I think it's important for people to understand something you just mentioned, and that is the comprehensiveness of primary care. I'm going to latch onto that in a little bit.
Okay, good.
So
that's really important.
Yeah, I'll set it up by basically saying I see a lot of ignorance. And keep in mind that since I live in Panama and I have a whole bunch of expat friends from all over the world, so I get exposure to many different medical systems and perceptions of care. And I guarantee you the person who comes in from Spain has a completely different perception of care than a person from the U.S. And so You get expats arguing over what is great care, and they really aren't defining the care. So bottom line is, in Spain, they have terrific primary care. In fact, they focused on it starting in 1986. So there's a lot of ignorance driving the perception that primary care is only for simple things. Hey, thanks for listening to another healthy snack from the winning healthcare food fight snack bar. If you're finding them tasty, please click like and consider subscribing to have more guilt-free snacks as they're served. Listen to the full show by following the link in the description.